My name's Donald MacDonald. I'm a consultant urological surgeon and clinical service lead for urology here at UXEW. The critical issue with curing prostate cancer is to remove all of the cancerous tissue, but also leave behind all of the non-cancerous tissue. At the moment, there's about 25% of patients in whom we don't take enough tissue away, and about 25% of patients in whom we take too much tissue away. And at the moment, we don't have any tools that are usable in everyday practice that can help guide how radical our dissection should be. So we are hoping that the XEOS will allow us to perform the very minimal amount of surgery, examine the specimen whilst we're in theatre, whilst the patient is asleep, see if what we've done has been sufficient to cure the cancer, and if it has, that's brilliant. We can leave all of the adjacent structures intact, whereas if the XEOS tells us that there is still likely to be residual disease, then we can go on and extend the limit of our dissection.
We recognise that there's a real ability to improve the surgical margins for tumours being removed. So essentially during procedure, the surgeon is able to have greater confidence with regards to the tumour being removed and the surgical margins, meaning that patients are less likely to require things like salvage radiotherapy that requires additional and unnecessary stress for the patient, and also unnecessary additional care when it can be achieved through one procedure.
It's genuinely very, very exciting. The most radical prostatectomy surgeons would agree that there are certain centres around the world that offer a gold standard service. The XEOS, if it performs as promised, would allow me to deliver that level of service, which is massively empowering for me. We are genuinely very, very excited about what this can offer.